Well, as of this morning, the oxygen inside the Titan is expected to be depleted. But one expert says that although that 96-hour supply of oxygen inside the vessel, it doesn't necessarily mean that passengers have used it all up. Dr. Ken LeDez is a medical director of hyperbaric medicine at Memorial University. He joins us now from St. John's. Good morning to you, Dr. LeDez. Let's start really with the beginning here. I'm wondering if you could perhaps explain to us why the oxygen timeline here in the Titan is not as linear as perhaps people may expect.
Oh, sure. Well, first of all, it's only an estimate. It's no way to say exactly, how long and how much oxygen people are using up. It's also important to remember that likelihood is that the individuals, they're very smart, they're very accomplished people, and they're doing their best to survive. They're doing everything possible to try to reduce their oxygen consumption without any question. But as they get colder and colder, if they get hypothermic, then that's actually going to reduce their metabolism. That means it's going to reduce the amount of oxygen that they're needing and consuming, and it's going to reduce the amount of carbon dioxide that they're producing. And that hypothermia, it will also have protective effects on their brain and heart and vital organs. So what it means is, even if they do lose consciousness because of the hypoxia, low oxygen, hypercarbia, that's the high carbon dioxide, and hypothermia, that is still possible that it could be survivable. And of course, we don't know what the conditions are inside. We don't know if everybody is still alive. If any have succumbed, then that will extend the oxygen supplies for the other. I mean, as gruesome and as tragic as that sounds, but there's all these factors. But definitely hypothermia is protective and reduces the metabolic rate and oxygen consumption. And they will be getting cold by now, almost certainly.
It's, not every day that one thinks of hypothermia as possibly a good thing. That aside, though, what kind of effective measures could the other passengers be doing to conserve more oxygen?
Well, things like huddling close together, to maintain their body temperature so they don't shiver as much. I mean, shivering is going to consume a lot of oxygen, but as they get colder, that effect will pass off and they'll stop shivering. And but huddling together to conserve warmth, minimizing any activity within the if they are banging, then just having one person do it and at particular intervals. And we don't know if they still have power on the vessel or not, and whether the systems for monitoring the oxygen or reducing the carbon dioxide there and how dependent they are on power. Do they have backup systems? I'm not sure. Do they have to add oxygen manually? Is it all automated? Are those systems still intact? But the bottom line is that critical medical events happen all the time, every day in hospitals, and although they might not be ideal conditions, patients do survive. So that even if the individuals lose consciousness and get very cold, it's not the same as them all being dead. They may still be possible of being rescued.
You sound hopeful. Is that a fair, accurate description?
Well, I certainly wouldn't. I definitely wouldn't give up. I'm really hopeful when I heard the news just a short time ago on your program that a vessel capable of getting a wire onto a line onto the submersible is now in St. John's, because all these factors that we just spoke about could buy enough time, for that vessel to get out on station if they can find it. So they're frantically looking, and now they're going to deploy this vessel that might be capable of pulling it to the surface. So it's definitely way too soon to give up hope. And the oxygen may last longer than people think.
And so many variables, as you said, at play here, including the temperature. Perhaps you can talk to us a little bit about, can temperature of the vessel impact how much or perhaps how little oxygen the passengers may be using? How does that play into it?
Yeah, but the colder they get, eventually then the heart rate and breathing rate will slow down. And it's often said in medicine, when it comes to hypothermia, you're not dead until you're warm and dead. And so what that means is people's vital signs can really slow down a lot, but they can still be survivable. And lots of people are aware of stories of people, going underwater, getting very, very cold, or being outdoors, getting very, very cold, and yet being resuscitated, back, to normal or almost normal. So I think that hypothermia is protective. For example, hypothermia is used in certain cardiac operations and other such situations, such as after a cardiac arrest, to try to preserve brain function and cardiac function, for example. And that hypothermia is definitely a protective effect. So as they cool down, not only will the oxygen requirements get less, but also that cold temperatures is helping to preserve those vital organs.
Okay. If enough carbon dioxide, doctor, has filled this vessel, what would that mean for the passengers inside?
So carbon dioxide will stimulate the autonomic nervous system. What that means is it's going to get them breathing faster. Their heart rates will go up. It will cause anxiety. But also as the level gets higher and higher, then it has a sedating effect. So by the time you get past 70, 80 or more millimeters of mercury, it is sedating. So it will start to calm them down. But that can be counterbalanced by their temperatures going down, which will have the opposite effect of slowing down their breathing and slowing down their heart rate. So again, that cold temperatures may have a protective effect. And carbon dioxide, we don't know this. We don't know whether they still have power, whether the carbon dioxide absorbing material, whether that's exhausted, how long that's going to last, because I just haven't heard any information about that. So they may have been able to reduce power consumptions to try to keep other systems going. By, for instance, they might have been able to disconnect the power for the carbon dioxide scrubbers and just take the material and spread it out on the floor in there so that it can have more exposure to the environment. So we just don't know how high that the carbon dioxide is, but hypothermia will counteract some of the effects of the high carbon dioxide levels.
And the other thing, of course, we don't know is how much air is left in that vessel. We know the vessel has a 4-day or had a 4-day oxygen supply. If the passengers are doing all the right things, doctor, how long could they survive beyond that 4-day limit?
Well, if they get cold, and if they've reduced activity, and if the supplies are a bit better, than perhaps this first thought, then the question is, could they get, another day or 2 or 3? I think it's possible, especially, if some people have succumbed, which, I certainly hope is not the case, but it's definitely much too soon to give up. And I'm sure once they have the vessel ready that can potentially lower a line to it, that they're going to get it and move as fast as possible to the site. We are looking at possibility of a further survivability for days, at least 1 or 2 days, perhaps, even if they're unconscious. So time is of the essence. But it's definitely too soon, to give up. I think they need to do everything, and they are doing. It's very impressive, the effort that's going on internationally for this.
And it is an international effort. Many eyes watching this from all over the world. Dr. Ken LeDez, thank you so much. Dr. Ken LeDez is a medical director of hyperbaric medicine at Memorial University.